Thank you. Broadcast services, I believe we are ready to go. And at this time, I am going to commence the meeting of Assembly Committee on Health and Human Services. Madam Secretary, can you please take the roll?
Here. Here.
Here.
Here. We have a quorum, so we are going to get started because we have 4 bills on today. Before we begin, I just make several housekeeping announcements for all the individuals that are present in our meeting room. Please keep your face coverings on and maintain your social distancing. You'll see all of our chairs are separated for those of you that are present here today in the committee room. Additionally, members of our public may continue to provide testimony in various ways, all of which are listed on the agenda and on Nellis. Again, I'll remind everyone you may submit public comment in writing in addition to testifying or in lieu of testifying, and that written public comment may be submitted before, during, or up to 48 hours after the meeting's adjournment. And finally, if you are in here, I would ask you to please silence your electronic devices, cell phones and laptops. And for those of the members that are in here, if I can remind you to mute your little dinging things, because they will make little bell noises and all kinds of fun noises here during the thing. And with that, we will move on to our first agenda item. I will now open the bill hearing on, let's see, hold on one second. Are we going in a particular order? Okay. I will start with, I don't see on the Zoom any of our senators here yet to present. Assemblywoman Hanson, are you presenting with Senator Harris? Okay. Okay, perfect. So we will start with Senate Bill 21. This revises requirements relating to background investigations conducted by certain institutions, agencies, and facilities that serve children. I believe Mr. Armstrong is on our Zoom. I see him right up there, big on the big screen. Welcome to the committee, and please begin when you are ready.
Thank you, Madam Chair, members of the committee. It's great to join you on Denim Day at the legislature today. SB 21 started really as a boring, kind of nerdy government administrative bill to standardize the crimes that we check in child serving agencies in terms of background check for hiring employees who are working with vulnerable populations. In DCFS, we actually currently have 3 different sets of rules about the backgrounds that can either disqualify or qualify an individual to work on our agency. And so we would occasionally get an employee who wants to transfer, promote their career, but they can't get from one part of the agency to the other because of these differing background checks. So the original SB 21 just set really to standardize the list of exclusionary crimes across the board, and then also put some time limits, particularly on minor drug offenses. We had, a lot of folks that had minor drug charges, and it didn't matter how old they were excluded from working at the agency. So that's what the original bill did. And every bill starts as an idea, and then it opens doors to conversation, and you hope you get to change. And so as we worked with stakeholders throughout the process in the other house, it became clear that when we're talking about these child serving agencies, we're talking about agencies whose whole idea of existing is to give folks a second chance, a brighter future ahead of them than what they may be experiencing now, and that our employment practices should reflect those core values of our agencies. And so the bill was amended so that there is consistency in terms of what crimes are checked across the different parts of child serving agencies, but that also giving each one of those agencies the ability to do a weighing test to determine if somebody does come back with a particular crime on their background and the statute says that they can be excluded, that you can really take a look at each individual situation and weigh the crime, the conduct that occurred with what their role is going to be, and that those exclusionary crimes can be waived so long as that objective test is followed. Anytime we add human discretion, of course, there's an opportunity for human bias implicit or otherwise. And so also amended into the bill is a requirement that an agency that is using that weighted test periodically checks the results of that test to make sure that there aren't biased results in those tests. So we started with just making sure all the crimes were consistent. We've added this ability for agencies to waive that. And one of the other factors that really helped us move in that direction was that in working with the families and the children that we work with, there's inherent value a lot of times in lived experience. And so we're unable to hire folks who, because of their own life experience, can actually really help in the rehabilitation or the safety of our children. So to run through the actual sections of the bill, we're talking about three different types of entities, really. Juvenile justice detention centers and facilities, child welfare agencies, and then state-operated mental health facilities for children. Some of the things we did across the board too, including the time limit on drug offenses, was to add domestic violence as one of the crimes to check against, because we had seen that crime actually had some behaviors that existing behaviors into the workplace that were not good. And then in talking with stakeholders, prostitution alone itself has been removed due to the nature of how that crime is typically charged. So in the bill, sections 1 and 2 apply to those juvenile justice agencies. 3 and 4 makes the adjustment to the child welfare agencies. The child welfare statute really had the most comprehensive list to start with, and so that really served as the model for the others. Sections 5 and 6 apply to division-operated mental health facilities, and then Section 7 gives the bill an implementation date of January 1st, 2022. That would give us sufficient time to implement the weighing test and for the division to provide any technical assistance to those local entities that were trying to do the same thing. So that is SB 21. The main goal is to have some consistency in our background approach across child serving agencies, and then also having an opportunity to take a look at each individual case to make a determination of whether past criminal conduct still presents a potential risk to the agency or the individuals they serve. With me is Sherry Vondrak, the DCFS personnel officer, who did a tremendous job in terms of researching what other states were doing and found that Oregon was using this weighted test, and so we're happy to answer any questions the committee may have.
Thank you. And I am looking around here to see if we have any questions from committee members. And I'm looking around and I'm looking around and I didn't receive any. Oh, I have one from Assemblywoman Krasner.
Thank you, Chairwoman. Thank you, Mr. Armstrong, for your presentation. So if you could just explain briefly, what's the current law and then how are we changing it? Thank you.
Thank you for the question. So the current law varies from agency to agency. So for example, in the child welfare agencies, they had the greatest list of exclusionary crimes. The juvenile justice ones didn't have us check for involuntary manslaughter or require that a felony, have use of force or threatened use of force. And so what it does is in the mental health and juvenile justice statutes, it adds to that list. I would say the biggest changes are the time limit on drug offenses, the inclusion of checking for domestic violence, and then the addition of the sex crimes with the exception of prostitution, because we know in a lot of cases those are instances of coercion that is charged that way. So those are the big ones. And then, of course, as the process went, the biggest thing is that right now, if any of these crimes pop up, it's automatic exclusion. There's no discretion. So we've had cases where somebody was, convicted of marijuana in 1982, and they've been great since, and they want to come work at one of our juvenile justice facilities, and we have to say no. In this case, we could weigh the length of time that it's been and all those individual factors and actually hire the individual to work at the agency. So that's the biggest one. Is the way the law works now is if in each of those particular areas, one of those crimes pops up, they're barred from employment. This would give discretion to the agency to take a closer look at those cases and hire an individual regardless of that particular crime.
Follow up.
Thank you, Chair Wynn, for the follow-up. And thank you. I appreciate that we want to give people a second chance regarding drug-related offenses. It's not possible with this bill that someone who was convicted of molesting a child or raping a child would now work in child welfare services, correct?
That is correct. I would imagine that all of the agencies that would imply that weighted test would have particular offenses that no matter what the circumstances are would still be prohibited. In particular, in our juvenile justice agencies, we have to comply with the Federal Prison Rape Elimination Act. And so that would absolutely be a non-starter for those entities.
Thank you.
I think we have a question from Assemblywoman Summers Armstrong next.
Thank you, Chair Wynn. Thank you, Mr. Armstrong, for your presentation. Just want to clarify, I saw in here, and now I can't find it, that there would be a review every 2 years. Is that if the person is hired with something that you all are giving them not a pass, but your probationary or situation? Or is that if someone after employed gets into trouble and you're going to review every 2 years, or is it both?
Thank you for the question, Ross Armstrong, for the record. So there are 2 review periods, and thank you because I overlooked one piece. So currently, so this doesn't change a lot. Currently, after someone is hired by one of these entities, they have to run the background check every 5 years to make sure that no new crimes have popped up. There's some clarifying language in the statute that talks about what pending charges is for that analysis by the agency. The 2-year review is that an agency who's using that weighted test to waive those exclusionary crimes has to be checking it every 2 years to see if the results of that test, not for an individual, but agency-wide, have any bias or discrepancy. So if 2 years down the road, you're looking at the test and, all of the Black applicants were denied using the test and all the white applicants were approved using the test, I mean, that's a huge red flag that you want to address your application of the test. So because we were adding that human decision point, we wanted to make sure that there was data collection and regular analysis to make sure that there wasn't that human bias seeping into the system. Knowing that the hard, we know that the hard line, like no discretion in statute, can then lead to just structural bias there's no way out. So we wanted to make sure that those entities were regularly taking a look at their practices with an eye towards making sure that those areas where there was discretion weren't being misused.
Madam Chair, follow-up?
Go ahead.
Thank you. Thank you, Mr. Armstrong. So, cut and dry, I'm an employee of one of your either juvenile justice, child welfare, or mental health. After I'm hired, every 5 years, you're going to run a background check on me, period. Correct?
Correct.
If I'm hired with something in my background and you are using a waiver to employ me, I smoked pot in wherever, 82, and got convicted, but I'm a model citizen and you're going to hire me, I can bring something to that agency, you're still going to check me every 5 years. Is that correct?
Correct.
But the 2-year waiver, the 2-year review is to ensure that your agency is, without bias, applying the waiver like you gave me to everybody evenly.
Correct.
Okay, got it. Thank you.
And that was Mr. Armstrong for the record. Do we have any other questions from committee members? Last chance, last chance. Seeing none, at this time, I will ask Broadcast Services. I don't see anyone on the Zoom here to testify in support of Senate Bill 21. So if we can go to the phone lines for testimony in support of Senate Bill 21. Again, I would remind callers to please clearly state and spell your name and limit your testimony to 2 minutes. Again, we will be timing each speaker to make sure everyone is given a fair opportunity to speak. Broadcast Services, if we can begin testimony in support.
To testify in support of Senate Bill 21, please press *9 now to take your place in the queue. Caller with the last three digits, 725. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, thank you, Chairman and committee members. This is Nick Shepak, NICKSHEPACK, Policy and Program Associate with the ACLU of Nevada. I had hoped to be in the building with you today, but was rejected, so I'm all dressed up with nowhere to go. I want to thank Mr. Armstrong for working so hard with us on this piece of legislation. We believe that the reprinted version of this bill represents a department that really believes in second chances and that can hire the best people to work with kids, especially people with maybe checkered pasts, but who have been doing really well. We think this bill is a great step for the department, and we encourage you to support it. And again, thank Mr. Armstrong.
If we can go to our next caller and support.
Sorry, Chair. Caller with the last three digits, 685. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chairwoman and members of the Assembly Committee on Health and Human Services. For the record, my name is Daniel Perot, spelled DANIELPIERROTT, with Argentum Partners, and I am testifying in support of SB 21 on behalf of our client, Fingerprinting Express. Fingerprinting Express utilizes the latest technology in fingerprint background checks, in addition to a myriad of other services to ensure the safety and security of Nevadans. As it stands, there are over 80 industries in Nevada that are required by statute to complete a fingerprint background check. While we think that anyone who works with children should complete a fingerprint background check, this piece of legislation moves the needle in creating additional protections for Nevada's children. With that, we would like to conclude by thanking the committee for hearing this important piece of legislation, to Minister Armstrong for his work on this issue. Thank you for your time and consideration.
Chair, there are no more callers in support at this time.
Thank you. Do we have any callers in opposition of Senate Bill 21 on the line? I don't see any on Zoom. I don't see any in the room. If you are, come up to the table. None. If we can go to the lines then.
To testify in opposition of Senate Bill 21, please press *9 now to take your place in the queue. There are no callers in opposition at this time.
Do we have any callers in neutral?
To testify in neutral to Senate Bill 21, please press *9 now to take your place in the queue. There are no callers in neutral at this time.
Wonderful. At this time, I will turn this back over to Mr. Armstrong for any closing remarks you might have.
Yes, Ross Armstrong for the record. Thank you, Madam Chair and members of the committee. There's a few bills where you start out and you get actually more and more excited about the bill as it goes along, and this has been one for us as we made that shift from kind of nerdy administrative law change to real change in the way we approach employing our staff. And so I thank you for your time and consideration. If there are questions as we go forward, please feel free to reach out. But other than that, we're proud to present today and hope you have a great rest of your hearing.
Thank you, Mr. Armstrong, for that presentation. At this time, I will close the hearing on Senate Bill 21. At this time, I will open the hearing on Senate Bill 143. I see Senator Harris through the window outside of here. And now I see her walking in. So wonderful. We might have to have some music that plays when people come up. I did open the hearing on Senate Bill 143, Senator Harris. Please begin when you are ready.
Well, good afternoon, Chair Wynn and Committee on Health and Human Services. It's my pleasure to be with you all this afternoon. Thank you so much for taking the time to hear Senate Bill 143. This bill has been a labor of love. Just to let you all know, you read that right. This is sponsored by myself and Assemblywoman Hanson. I like to tell folks that means it's either a really, really good idea or a really, really bad one. I'll submit that it's the former. So, Just a quick rundown. I don't want to take up too much of all of your time. The basis behind this bill really is to codify the idea that parents know their children best, that they should allow their kids to go outside and play, engage in what we call independent activities, if it's safe to do so. This by no means says that any parent who thinks their 2-year-old is an Olympic swimmer and doesn't need floaties would not be able to be prosecuted for child abuse and neglect. However, it does provide some guidelines for both DFS as well as for parents to make it clear that if you'd like your child to be able to walk to school by themselves or with a group of friends, that you won't have someone banging on your door simply because you left your kid at home while you went to the grocery store, while they had their cell phone and were up online and able to reach you in multiple ways. We know very well that these types of laws are often applied a little bit harsher towards folks who don't have as much money, folks who don't look like the majority of people in this country. And so the second piece upon this bill is to try and provide a little bit more equity in that application. At this time, if you all don't mind, I'd like to invite my co-sponsor, Assemblywoman Hanson, to the table to speak a little bit about why she felt it was important for us to team up and bring this bill to you all.
Welcome to Assembly, Health and Human Services, Assemblywoman Hanson. Please begin when you are ready.
Thank you, Chair Wynn, and thank you, committee members, and thank you to Senator Harris. Senator Harris and I have a secret. She's my favorite senator, and but we'll just keep that in my room because I don't want Pete G to find out that he's now my second favorite. So, for the record, I'm Assemblywoman Alexis Hanson, District 32, and again, thank you for your time and the opportunity to hear the Reasonable Childhood Independence Bill, and I'm honored to be co-sponsoring with Senator Harris. I serve in the interim on the Child Welfare and Juvenile Justice Committee, and I'm very aware of the very serious issues that face our children and families in the state of Nevada, and that's not lost on myself nor on Senator Harris. I've appreciated the opportunity that we've had to be able to talk to many stakeholders and appreciate their input and the amending language that's been submitted. So let's first and foremost make it really clear that the intent of this bill is not to make the important work of law enforcement or child protective agencies and prosecutors more difficult. We appreciate the difficult work they attend to in our state on a regular basis. We are here today to talk about the other end of the spectrum, responsible parents, and the sometimes unnecessary hindrances or the stigma that they can be caught up initially in the broad scope of that Nevada neglect statute that is very broad. We hope with this legislation to assure responsible parents that they can use their reasonable judgment to determine if their children are capable of independently engaging in certain childhood independence. Many of you know that Senator Harris and I were raised by single moms, and I worry that if they were raising us as children today, that our mothers could be caught up in this broad net of neglect statute. My mother's circumstances were such that she allowed me, and sometimes had no other choice than to allow for me to experience reasonable childhood independence, and I benefited from that. And in turn, my 8 grown, very successful children are products of growing up with the same kind of confidence that I was allowed to develop. Today, many parents and legislators do not know what is allowable by law for their children to engage in these independent activities. Unfortunately, a culture of fear has begun to grip many parents in our communities about what is okay, what is neglect in the eyes of the law, or even in the eyes of their neighbors. I see this legislation as enabling good parents to be given the autonomy to make decisions about their childhood's independence within reasonable, and that's the key word, reasonable guidelines that are codified in statute. This is not a solution in search of a problem. The problem already exists. Parents in our communities today are being stigmatized. I thank you for your time, and we look forward to taking questions, and we'll turn the time back over to Senator Harris. Thank you.
Senator Harris, are you ready for questions, or do you have some additional comments as part of your initial presentation?
Just a couple of additional comments. In the spirit of working with stakeholders, we have gone back and forth on language, I would say, 50 or so times. I want the committee to be aware that the most recent amendment that you have before you will likely be changed one more time. And I just want to, with your permission, Chair, read through what I'd like the language to ultimately read in section 1.5, subsection 2.
Senator Harris, Mr. Ashton, our policy analyst, I think he has something to clarify as well.
Yes.
For the record, Patrick Ashton, Committee Policy Analyst. Members, we just received the amendment from Senator Harris, and I sent it to you by email. It should be uploaded on Nellis shortly if you want to follow along too.
Yes. Thank you very much. Ultimately, subsection, I believe it is B, will read after line what's 43 pursuant to NRS 62E.280. Everybody with me? Okay, lovely. We'll read, or the child is alone or with other children outside the direct supervision of the child's parent, guardian, a step-parent with whom the child lives, an adult person continually or regularly found in the same household as the child, and the child is of sufficient maturity, physical condition, and mental ability that indicates that their health or welfare is not harmed or threatened with harm. D, being alone or with other children outside the direct supervision of the child's parent, guardian, a step-parent with whom the child lives, an adult person continually or regularly found in the same household as a child, as defined in subsections C, may include a child engaging in independent activities. And you'll see that then connects to DCFS putting forward some regulations to further define what independent activities are in order to give both courts and those who are out in the field clear direction on what it actually means for an independent activity to be engaged in, and that connects it with the legislative intent even further to allow parents to let their children be children. With that, Chair, I wanted to let you know we have two folks on the Zoom, Miss Diane Redleaf, who is the legal consultant with Let Grow, and Dr. Rachel Flynn, who is a child development psychologist. They are both available to answer any of the more technical questions the committee may have. Thank you.
Perfect. Thank you so much. At this time, I'd just take a point of privilege here to say that I'm really excited about this bill. Having two young kids of my own age, I think, recognizing their maturity, their responsibility, I think giving them these kind of freedom only improves their ability to cope, their ability to problem solve, and gives them confidence. So thank you for that. I think we have some questions here. I'm looking around here. Assemblywoman Benitez Thompson, go ahead.
Perfect. Thank you so much for the questions. I appreciate it. And so I was just reading over the amendment, and I appreciate it because it looks like you're working really hard to, by regulation, get intent and on concepts, right? And that can be really hard because we know that other states might put a hard and fast age in, but it looks like when we talk about, let's take the word maturity, you're going to want the department to define through regulation what maturity is. So I guess for the direction to the department on how they might draft it, could you give us a little bit more for the record about what you would see the intent is around maturity when it's not tied to a chronological age?
Thank you for the question, Assemblywoman, to you through Chair Nguyen.
Feel free to go directly to the member asking the question.
Thank you so much. To you, Assemblywoman, I think you hit it right on the nose, right? The idea of putting in a hard line age for this type of legislation really just is not appropriate, given that we know there are some, let's say, 8 or 9-year-olds who are able to be at home for 30 minutes, and there are other 8 or 9-year-olds who will set the place on fire. And so the maturity really is about allowing the parent to make a reasonable assessment of what their child's capabilities are, of course, within the norms of childhood development. And I think it's best that the department is able to take input from the folks in the field, from people in different regions of the state, and be able to come up with a clear guidance on what that looks like.
Perfect. And that's going to be the sticky widget, right? And so I guess explain to me how you, I guess as the bill sponsors, how you imagine this playing out. So right now, let's take it, an apartment complex situated next to a busy street, right? So there are children playing outside unsupervised. Anyone can call to say, I see children unsupervised. That call goes into child welfare. There's a worker there who takes that call and has to figure out, is this, how fast do we have to get there? And one of the things that they'll usually ask is like the age of the children. Makes a difference if it's a 3-year-old versus an adolescent looking child. So they'll still go through that process. So I guess ultimately, if the child, if someone were to show up, if, they send out a social worker, I guess at what point, what are those decisions what are the criteria that you would want that worker to consider before they would make a decision to take a child into custody or take other measures? Determine that they need to be involved, I would say involved versus not involved.
Thank you for the question, Assemblywoman. You hit on a couple of things that I just want to point out. One, there's nothing in this bill that would not suggest folks should continue to call CPS, right? Like relevant citizens who see something wrong should continue to call. And so this bill does not touch, at least on that front end process, right? I don't expect people to stop calling when they think a child is truly in danger. And, we all may disagree about that, but, there's very little we can do on that end. And for the most part, it can be helpful in finding bad situations, right? So when it comes to the social worker assessing, I'll be honest, that is not my expertise, that's theirs. And I think a lot of what we're trying to codify is practice that they're already doing, right? They aren't removing children who are maybe outside playing on their bike, even if they do have to show up as a matter of protocol. And so, frankly, I trust the social workers in the field to make these calls and assessments. They're well versed in it. What you're also looking at, though, is when people are actually charged for criminal abuse and neglect, right? And that's not often the social worker's necessary call right on the spot. And so we're giving both courts guidance, parents guidance, and the social workers as well. And I would suggest that out of the three, the social workers probably need the least amount of it.
Thank you so much. I just want to make sure that we're kind of getting a feel for how this would look. And I think that if the intent is taking some existing practices in which they can document that a child is safe, in which they would document that there's no harm and they're not going to substantiate a case, then it looks like what you're trying to do is to clear a path where regulations would better say what that is. And then those regulations would be the backing for whether or not an agency decided to take action or not. But you're not necessarily, and I guess we might hear it in more testimony, maybe in support of instances where parents felt that their children were safe and they got pulled into the child welfare system. So maybe hearing about some of those will help draw a little bit more of a bright line to help us understand where the system overstepped.
Thank you again, Assemblywoman Benitez Thompson. Dallas Harris for the record. Sorry, I've been failing at doing that thus far. That's correct. We want parents to be able to feel like they can do what they do. We want social workers to also feel like they can do what they are chartered to do. But I think the key here is to ensure and to make it very clear that if you are solely allowing your child to engage in these independent activities, as will be defined later, you should be left alone.
Perfect. And then we'll just clarify for the record, I'm sure someone else will, but even within our child welfare agencies, they might not all be social workers. I think county and state have policy on social workers, but Clark County has a different policy. So whether it's a social worker or a child welfare worker. Okay.
Correct. Dallas Harris for the record.
Thank you. I think next I will go to Assemblyman Matthews.
Yes, thank you, Chair, and good afternoon, Senator, Assemblywoman. Good to have you both with us here today. Sort of a follow-up, I guess, to Assemblywoman Benitez Thompson's question. I'm just wondering, given the flexibility, the lack of specificity, are there other states that maybe have something similar in place? And could that be something we could look to as a guide for what's been tried, what's worked, what hasn't worked, or just general lessons perhaps to be learned from experiences elsewhere? Thank you.
Thank you for the question, Assemblyman Matthews. I'll turn it over to Ms. Redleaf to answer that question. She's well versed on all of the different laws across the states. Ms. Redleaf.
Absolutely, and I'm just absolutely thrilled. My name is Diane Redleaf, Diane Redleaf. Thank you so much for that question, and thank you for hearing this bill. My role is to monitor the legislation around the country for the group Let Grow, and we have been working this year on in four states. Just today, I'm pleased to announce, just this morning, the bill in Oklahoma was sent to the governor on a reconciliation vote that took place this morning. There is a similar bill in Texas that is on a consent calendar in the Senate. And this legislation is modeled on Utah, which passed legislation in 2018 that sets out independent activities with children having sufficient maturity, physical condition, and mental ability. All of the bills that Let Grow has been endorsing, supporting, working with stakeholders on have that element of supporting independent activities, deferring to reasonable parental judgment. And I think Nevada so far is the only state where we are going to engage in a more detailed rulemaking process, which we look forward to providing that sort of guidance. The other states have it more spelled out in the law, what independent activities are, including walking to school, playing in parks, being alone at home, those kind of activities that the law has set forth. But they all have that element of maturity, physical condition, and leave the determination of neglect to the agency to make, using their judgment, using their own standards, and not really changing procedure, except to give parents that reasonable flexibility to make their own decisions based on their knowing the child best.
Thank you. And it may be a brief follow-up, if I may, Chair.
Go ahead.
It may be too broad to really get into this afternoon, but I would be curious to delve a little more deeply into what some of the lessons learned and what the experiences in other states have shown us. But that's probably something we can follow up on at another time. Thank you.
Assemblyman Matthews, happy to invite you down to the second floor anytime.
And I'm happy to take you up on that. Thank you.
Right.
Thank you, Chair.
Next, we can go to Assemblywoman Thomas.
Thank you, Chair. And thank you, Senators Hansen and Harris, for bringing this much-needed bill forward. And the only reason why I say that is because I, too, single parent, raising two children, and at one time I was active duty military. And my question, I'm sure that you wouldn't have a 3-year-old running in the street without, you can't say that a parent looks at a 3-year-old and say, oh, they're mature enough to be alone. But I'm wondering why a number wasn't put in the bill, because when I first got to Las Vegas, in order for a child to be alone in a house, I believe the age was 12. And I don't know where they picked that number up, but I do remember it had to be 12. So, until my children reached that point, I had to have a child care provider. And as a single parent bringing in one salary, that's really difficult. So I was just wondering why within this bill the guidance is the parent, and I'm grateful for that, because I think that's the way it should be. But we do have some parents that are not mature enough to believe that a 3-year-old running in the street, is mature.
Thank you for the question, Assemblywoman Thomas. I believe you're hitting exactly on why we don't have that age right into the law. One, I have a general belief that parents know their children best. Are there parents who misbehave? Certainly. And I believe this bill was designed to walk that line. Allow parents to make a decision based upon their child's maturity and ability, but also allow parents who leave 3-year-olds at home alone to be able to be prosecuted under the language in this bill. I think we can all agree, you are correct, that leaving a 3-year-old at home is not appropriate, especially for any sustained period of time. However, I feel free to admit on the record now, I've left my 9-year-old at home while I went to the grocery store, or, maybe went and picked something up from Walmart pickup on the curbside. So that's exactly why we don't have that number in there, right? You need to allow parents to be able to make those decisions. You need to allow parents to not feel like they can't step out when they need to go and do one or two things. If their child, of course, is of substantial maturity. I mean, especially with the price of childcare here in America. So you're hitting on something very real, I think, that this bill is trying to address.
Thank you. And again, I wish this bill was there when my kids needed it. Thanks.
Up next, we can go to Assemblyman Hafen.
Thank you,
Can
Madam.
we not?
Thank you, Madam Chair. I was just about to say that this is my favorite combo with Senator Harris and Assemblywoman Hanson. I have to thank you both for all the hard work you've put into this bill. This happens to be my favorite bill of the session. I think it is one of the most important things that we can be doing for our children, to let them grow in a manner that is fitting for each parent. And so I just want to say thank you. And I do have to ask a question, though. Would you consider this free-range parenting or cage-free parenting?
Thank you for the question, Assemblyman Hafen. I'm not sure those are mutually exclusive. We could call them both.
I think we need to
Thank you,
contact. I think we need to contact Assemblyman Watson. His chicken bill.
We'll get a final word on that.
I'm looking around. I know some people might have some other questions from some of the agencies that will probably testify either in support, opposition, or neutral. So if you are from one of those agencies, if you can just, after you make your statement, if you can give us a little pause to see if we have any questions from committee members, that would be greatly appreciated.
And Chair, I want to let the committee members know we do have Bridget Duffy as well on the Zoom. I know she will be giving some testimony as well, so be on the lookout for that.
Perfect. So just try to catch me, committee members, if you have a question for any of the people testifying in support, opposition, or neutral on the bill. Do we have any other questions for our bill presenters, though, at this time? Okay, I have Assemblywoman Summers Armstrong. Go ahead.
Thank you so much, Senator Harris and Assemblywoman Hanson. I just wanted to make sure, and I wasn't able to see it in my quick review, if the child has to use public transportation to get where they're going, is there a prohibition for that?
Thank you for the question, Assemblywoman. No, there is no prohibition for that. And I do think, although it's not in the list that we put down, I do think DCFS will have to consider allowing children to ride public transportation, whether that be to get to school or to the next activity, needs to be considered. That is a great question.
And thank you. And I thank you. This is Chandra Summers Armstrong, Assembly District 6. I think that is really important, and I think that there has to be clarity there. I'm in a district that is public transit dependent, and although I have and always have had, thank God, a vehicle, when I was single parenting and even afterwards, and my kids had school and then baseball, we did the whole training. This is where you walk to get on the bus, put your money in, sit next to the driver, and then go to baseball. And I think that really changes how children see themselves and grows their confidence. Plus, I was able to call the bus company, because I work for them, and have them check with the driver. So I think it's really important. So thank you. Please have them consider that.
Dallas Harris for the record. Definitely. I do know right now in the language it does say travel to and from school. It doesn't have a limitation on the mode, and so that's definitely the intention of this bill, is to allow children to be able to kind of engage with the world, right? That's how they become functional adults. And so learning how to take public transportation is definitely a part of that.
Do we have any other questions from committee members? I'm checking out my Skype chat here. I don't see any here. So with that, we will begin testimony in support. Is there anyone in the room? If there is anyone in the room to provide testimony in support of Senate Bill 143, I'd ask you to come to the table. Again, state your name for the record and limit your testimony to 2 minutes. There's a microphone button there. It's a little white button.
Clearly, this is my first time doing this in person. Hi, my name is Jillian Block, for the record. That's Gillian, BLOCK, representing the Nevada Coalition of Legal Service Providers. Washoe Legal Services and the Legal Aid Center of Southern Nevada represent 100% of children in the the child welfare system. And we support SB 143 because we believe it will clarify the law on child neglect and will help prevent unjustified interventions that disproportionately affect low-income families and families of color. Thank you very much for your time.
Thank you, Ms. Block. You did a wonderful job for your first time testifying.
Thank you.
Do we have anyone else in the room that would like to provide testimony in support of Senate Bill 143? Seeing none, I will go next to the Zoom because I'm not sure if there are individuals that would like to present testimony in support. Again, I would remind you to state your name clearly for the record and spell it, and limit your testimony to 2 minutes. Thank you. We will start way so far away. Ms. Duffy, are you testifying in support?
Thank you, Chair Nguyen. Yes, this is Bridget Duffy for the record. It's Brigid Duffy. I'm the Chief of the Juvenile Division for the Clark County District Attorney's Office. And I am speaking today on behalf of the Department of Family Services. I know Director Birch is presenting later on this bill, but we've been dividing and conquering with so many set today. So he is here as well. I am testifying in support. I originally registered in opposition because we've been working on amendments up and into literally about the time that Senator Harris took the table today. And so I want to very much qualify my testimony with, on behalf of the agency, that if these amendments, which have been presented today by Senator Harris, are accepted, then the Department of Family Services in Clark County are supportive of them, and thank both sponsors, Assemblywoman Hanson and Senator Harris, for working with us so closely. As far as this legislation goes, when the first week of the session came out, this bill was very quickly in our queue early on, and we had a meeting with the stakeholders from Let Grow and different child welfare organizations across the state. And what we were told as child welfare was parents don't know what they're allowed to have their children do. Parents live in fear that they can't leave their children alone. Parents in Nevada. So I offered an example of how I understand that maybe we aren't clear enough with parents. So we had a case here in Clark County where an 8-year-old had successfully killed himself with a firearm in a home. He was home alone with his 5-year-old sister, and it was ruled a homicide by the coroner, or a suicide by the coroner. And so we, that I got a lot of press calls saying, well, how come this 8-year-old can be home alone? Like, isn't that illegal? How old do they have to be home alone? And the answer to the press was, it's not an age-based decision. It's a maturity level, it's a developmental level, it's a physical condition level. So it was easy for us as stakeholders, from the district attorney's office to the public defenders to legal aid, to say, you know what, let's make it clear in statute so parents do understand that a child can be alone or outside direct supervision of a parent or a person, some of the people responsible for their welfare, if they are of sufficient maturity and physical condition and mental ability, and that indicates that they are not threatened with harm or would be harmed. So we basically said, let's make it clear for parents in the state of Nevada. The issue of the independent activities, that's the stakeholders or the lobbying groups issue. For us, alone is alone. And when a call comes into the hotline, just to address Assemblywoman Venus Thompson's issue and to clarify it for the record, we do not have a lot of removals in our county based upon lack of supervision, unless it's really young children that are found wandering in the streets in August in diapers without shoes on. So think about that when a call comes in. It's different from an apartment complex where a 5-year-old's on the swing set and maybe a neighbor is just calling in. That's if it's April and they're wearing a sweatshirt and they, it's the weather's fine and they're on the swings doing a childhood activity and nobody can see an adult around, that's not necessarily going to rush Child Protective Services out there. Now, if it's August and the child is 3 and the child doesn't have shoes on and the playground's hot and there's nobody there, like that may amp the situation up a little, as well as pools in children around pools, as was an example provided before by Senator Harris. We have to be very careful when we have young children around pools without adult supervision. Also, to address Assemblywoman Summers Armstrong's issue around public transportation. I grew up in the city of Philadelphia and we were taking the subway at a very young age because that's just how we got everywhere. So just to be clear, Child Protective Services does not go in and just remove children from being on public transportation. It is a mode of transportation. Children use it to get to and from school. Again, it is based on the maturity and the physical condition and the mental ability of the child. And we couldn't just put an age into statute because a 12-year-old may not have a mental ability of a 12-year-old. We have many 12-year-olds who have mental abilities of 3-4-year-olds due to developmental delays. So it is better to do these general criteria that will then be screened by the Child Protective Service hotline. So we hope by working with the sponsors, we've allowed our concerns as the people who practice day in and day out in the child welfare agency courtrooms and in the field, that alone is alone and it is okay. And a parent can be clear as long as their child is of sufficient maturity, physical condition, and mental ability that would indicate that they are not harmed or threatened with harm. And then allowed what the organization like Grow came in with, wanting to let parents and encourage parents to allow their children to get out and get some independence and do some activities, are also captured in this amendment as a balance for both us and them. So thank you very much. Thank you again to the Senator and Assemblywoman for working with us. This has been definitely one of the longest work bills I've had this session. So thank you, and I'd be happy to take any questions on behalf of the agency.
Ms. Duffy, thank you for staying on the line. We actually do have a couple of questions for you. If I can go to Assemblywoman Benitez Thompson.
Thank you so much. And once again, this is for the record because we're going to have the State Department promulgate these regs. And the same question that I had for Senator Harris is when we talk about the concept of maturity, I guess what would you want on the record to help indicate to folks who are going to be writing this regulations what you would hope to see encapsulated in that concept of maturity? Like what's going to be that, help to be that bright line so that we know kind of, I guess, I'm trying to figure out, are we listing, if we're not listing ages, we're going to be listing characteristics, and so I want to make sure we don't get into a circular reference where we have regulation that just ends up being as muddy as status quo.
Thank you for the question, Assemblywoman Medina-Thompson. I think that's absolutely right. We're going to be looking at basically situations. So take my example of the 8-year-old who sadly took his life. The 5-year-old sister was mature enough to know that she was the one who went next door to the neighbor, because the parent, who had a window of approximately 45 minutes between her working and the stepfather working, there was 45 minutes where the children would be home alone. And they had a plan with the children that involved the neighbors who knew they were home alone. And in fact, that 5-year-old knew to implement that plan as she was in the room with her brother who was dying. So that 5-year-old was of a maturity level, even in a crisis situation. So it's really about those, right, reasonable parenting, right? Like when I'm sure when Senator Harris, who put her personal, went to Walmart to pick up things, that the 9-year-old knew who to call if there was an emergency. In that 15 minutes, she may have been out of the house. So it's really those situational things.
So I guess then it sounds like we're talking about kind of protective capacities. We'll talk about, that's the way that a lot of times we talk about the ability of a parent when we're talking about neglect, right? Is their protective capacities, their ability to protect their child from harm and to do so willingly, right? So I guess then would you look for language and be supportive of language then that talks about a child's protective capacity, the capacity to know how to call for law enforcement or for help if they needed to? I guess would that be where the direction you would want to see people go?
Bridget Duffy for the record, and I know I failed to do that the last couple times. Assemblywoman Benitez-Thompson, yes, absolutely.
Do we have any further questions for Ms. Duffy at this time? Seeing none, thank you. Next, I will actually go, I believe we have Dr. Rachel Flynn. I saw her unmute and turn on her camera. Go ahead and provide your testimony. Again, I'd remind you to state your name clearly for the record and begin your testimony.
Hi, I'm Rachel Flynn. It's RACHELFLYNN. I'm a resident of Reno, and I'm a developmental psychologist, and I currently am a professor of child development, and I also have a private practice working with children. For over a decade, I was a director of youth development programs, and I worked really closely on many cases with Child Protective Services. Overall, I support this bill because I believe it's good for child development. I've worked with a huge range of children from diverse ethnicities, socioeconomic statuses, urban and rural populations, and also a lot of different cognitive abilities, from the gifted and talented to those with severe intellectual delays and who are nonverbal. I just want to address this idea of maturity. I think a lot of it's already been said, but it's very important to recognize that chronological age does not align often with developmental age. There's so many variations based on an individual child, their capacities, their cognition, their self-regulation, and also their culture. Context matters so much. The things that have been said around parent responsibility, but also professional responsibility in this. And so while leaving things vague might seem challenging, anyone who is trained to work with children understands the differences between chronological age and developmental age and knows how to take those contexts into consideration. I want to just say that the culture of fear that's been discussed previously is creating a culture of children who have higher mental health challenges. They have more learning disabilities. It's creating stress and anxiety and limits their agency. And what we really need to do is, over at overestimate sometimes children's developmental abilities. We need to call on the developmental science research to understand that children need to practice using their executive functioning skills to make decisions, to solve problems. They need to use their visual spatial skills to move through the world in different ways. They need to have these complex social interactions that flex their theory of mind. And they need to be able to play unstructured play that's not always adult or technology directed or adult supervised. And so for all of those reasons, that helps lead children to develop into being intelligent, resilient, and independent children. So that's what I want to say on the bill.
Thank you. Do we have any other callers on the Zoom that would go ahead and unmute yourself? And again, please state your name for the record, and please limit your testimony to 2 minutes. Thank you. Go ahead and begin.
Yes. Again, I'm Diane Redleaf, DIANE-REDLEAF. I'm the legal consultant to Let Grow, and I advocate for the laws such as the one you're considering today. I wanted to address a couple points that were brought up in the hearing. Our office did a 50-state survey of these laws that was published back in May. And I went back to that survey to look at the question of age limits. And what I found in that survey that we had done, an exhaustive study, is that approximately 13 states have some reference to age, but the age is all over the place. It ranges from, at the young side, 6, but on the old side, 12. And there doesn't seem to be any consistency about what the age allows for. Our concern about age limits, as Dr. Flynn just explained, is that they don't bear a direct relationship to actual functional abilities, and they can function as a double-edged sword. We have also seen policy guidance, though, in the course of reviewing these state policies on this, and we can provide some of that to the committee as they consider the rules, because guidance is something that not only the caseworkers and the social workers need, but the parents also need in order to know how they make a decision as to whether their child is mature enough. We believe that these laws, as they've been passing, actually help provide safety and security for children, because they not only address their mental health needs, but they make them more capable for the future. And so we talk about this as a measure that actually future-proofs our children. And as mentioned, we believe that there is tremendous variation in the needs of parents to be able to address the needs of their children in their own ways without having the chilling effect of the threat of a possible guessing wrong about what somebody else is going to think is neglect. So this is a small step. It doesn't change investigation procedures. It doesn't change the duties of mandated reporters. It will continue to support and increase the ability of Child Protective Services to concentrate on the serious cases and apply their judgment to the specifics of the specific children who are engaged in independent activities. We believe we need to more clearly define the difference between good and bad parenting, and that when children are ready, giving them independence needs to be within the lines that the law recognizes as part of good parenting. So thank you so much for considering the bill, and I appreciate the hard work that the sponsors have put into this, and all the consideration that the other advocates and stakeholders have put into this measure. Thanks so much.
And thank you for providing your testimony. I'm looking at the Zoom again. If there is anyone else that would like to testify in support of Senate Bill 143, I'd ask you at this time to turn on your camera and unmute your device. And I'm not seeing anyone. And if you are done speaking, I'd ask you to remute your device as well so we don't get that feedback as well. So at this time, I will go to the phone lines, broadcast service, if we can begin testimony in support of Senate Bill 143. I do see quite a few people that are registered to testify in support, which is wonderful. And I encourage people to take advantage of this. But feel free to say I support the bill, and ditto, and likewise. I know that we have a couple other bills that we are looking to hear today. And again, I'll remind everyone that they can also provide those written comments if they have additional comments to make in writing to the committee. And with that, we will begin testimony in support of Senate Bill 143.
To testify in support of Senate Bill 143, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 643, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. I'm so sorry for the background noise. I'm walking with my service dog. My name is Dora Martinez. I'm representing the Nevada Disability Peer Action Coalition. And thank you so much, Senator Dallas Harris. I used to be a single mom of 5. The 2 kids have made it to the military. One is in the Marines. We do know our children better than anybody else, despite our disability. Thank you so much. Take care and have a great Wednesday.
Caller with the last 3 digits, 945, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello. Thank you, Chairman and committee members. This is Nick Shepak, Nickshepak, Policy and Program Associate with the ACLU of Nevada. It was brought to my attention that I was actually allowed in the room. I will exercise my reasonable independence moving forward to double check any emails I get declining me. I will try to be brief here, as I know we have many callers on the line. The ACLU believes that this bill addresses a very serious racial justice issue. To drive home that racial justice issue, I want to share a few numbers from Washoe County. From 2016 to 2020, the North Lake Tahoe area, which is 95% white with a population of about 10,000 people, had 42 child welfare investigations and only 2 child removals. The South Reno area, which is 90% white, has a population of 27,000 and had 142 investigations and 33 removals. The zip code in which I live in Reno, which includes Midtown and the area around the Reno airport, is only 65% white, with a population of about 40,000. It had over 18,000 investigations and 535 removals. North Reno, up to the North Valley, is 59% white and has a population of 20,000. They had over 1,000 investigations and 336 removals. What we have found through our research in looking at zip codes is that by looking at the number of investigations and child removals, you can directly tell which zip codes have the highest minority populations. This is a real problem, and we believe that this bill takes real steps to addressing this issue. And for these reasons, as well as with the other reasons stated by the presenters, we urge you to support this bill. Thank you so much.
And I will just note that Mr. Shepak, his name is listed on here, and I know that Vice Chair Peters is a talented artist, so maybe she could draw his picture, and it'll be like he's here. But if we could go to our next caller in support of Senate Bill 143.
Caller with the last 3 digits, 945, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 945, please press star 6 to unmute.
Sorry about that. My name is Charlie Melvin, CharlieMelvin, with Power to Parent, and we represent nearly 10,000 parents across the state of Nevada. Our organization exists to empower parents to advocate for their children because we believe that parents know their children best. We are in support of SB 143 because we believe that only parents understand the maturity of their child and can best make decisions regarding their level of independence. We also know low-income families can be disproportionately affected for multiple reasons, but especially because both parents may need to work, and families should not be punished for providing for their families. Parenting is difficult enough without the fear of CPS or other government agencies second-guessing reasonable parenting decisions. We understand and appreciate the need for these agencies in cases of real and serious neglect or abuse, but we also know that responsible parents can and should be allowed to make reasonable parenting decisions about the maturity and independence of their kids. We are grateful for this bipartisan legislation that protects the rights of parents to make reasonable parenting decisions for their children. To that end, we also appreciate Assemblyman Hafin's question and agree with Senator Harris that both free-range and cage-free parenting titles are appropriate for this bill. Thank you very much, and thank you to everyone who worked on this.
Thank you. If we can go to our next caller in support.
Caller with the last three digits, 426. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Bingo, that's me. Hi, my name is Lenore Skenazy, Lenoreskenazy, and I'm president of Let Grow, the nonprofit that promotes childhood independence. We push back on the idea that helicopter parenting is good for kids. Before this, I wrote a book called Guess What? Free Range Kids. That's my book, not Cage-Free Kids. And that started the Free Range Kids movement. At Let Grow, we believe in safety, helmets, seatbelts, car seats, all the ways parents keep their kids safe from unnecessary harm. We also believe it's great for kids to have some independence, just like you've been hearing throughout this amazing, amazing session. We think that kids can run some errands, climb some trees when their parents feel they're ready for it. But I get so many letters from parents saying that they want their kids to walk to the store or play outside or wait at home while they go to Walmart. They don't want them on the couch all day staring at a screen, but they're afraid to let them do anything on their own because someone could call 911, someone who doesn't know their kids the way they do. So they second guess themselves and keep the kids inside. The problem is that when kids are treated as if they're fragile, they start to believe it. Childhood anxiety and depression are on the rise. But in 2018, as you heard, Utah passed the law changing that. That was the free-range parenting law. So what we heard from parents in Utah who told us that once the law passed, they could breathe easier. One dad told us he was kind of a helicopter dad. He was always worried about letting his kids walk to school or trick or treat without an adult. But as they got older, he saw the kids were getting frustrated easily and unable to solve problems on their own. And for this, he blamed a lack of real-world interactions. Those kids weren't getting on the bus, paying the right money, and sitting next to the bus driver. So in desperation, he started to let them play in the park on their own and wander around the neighborhood and play. And thanks to Utah's childhood independence law, he felt he could do what was best for his kids. Sometimes I ask people, and maybe I'll ask you, to think back on what they most loved doing as a kid. Almost everyone will say what I bet you would say, which is they love playing with their friends, riding their bikes, building forts. No one has ever said that what they loved most was having their mom right there, hovering over them. That's why we're so excited to be working in Nevada, and we so appreciate our sponsors and all the stakeholders, all the people that have spoken today. Together, I think you will do great things for the kids and parents of Nevada. Thank you for supporting reasonable childhood independence.
Thank you. If we can go to our next caller in support of Senate Bill 143.
Caller with the last three digits, 542. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello and thank you. My name is Andrea Keith, ANDREAKEITH. I'm the executive director of Let Grow, and I happen to be a resident of Nevada. I started my career as an elementary school teacher in California and also taught in northern Colorado and rural Illinois. My classrooms were always very diverse academically, economically, and racially, and I had to fulfill my obligation more than once as a court-mandated reporter. So I believe strongly that society must protect children from harm, but I also have known hundreds of children who, while in the same grade, were each unique in their maturity and their capacity for handling things on their own. Experience is definitely the best teacher, and children children need to be able to learn to navigate their world, advocate for themselves, and solve real-life spontaneous problems. which is difficult to do if we keep them inside and don't give them those opportunities. I can tell you that child development experts, psychologists, and educators will all tell you that children who are allowed to have independent experiences are more resilient, happier, more confident, and more successful in school. In fact, this is one area that can give lower income and other cultures an advantage, as their children are often expected to be more mature and independent out of necessity, as opposed to privileged children who frequently have things done for them. I thank you for your attention and considering this bill, and I'm very proud to be a Nevada resident with this going on. Thank you.
Thank you. If we can go to our next caller in support.
Caller with the last three digits, 501. Please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last three digits, 501. Please press *6 to unmute.
Sorry about that. This is Daniel Hansen, Hanscn. I am a physician and a father calling in support of this bill. Thank you, Chair and Assembly Committee, for hearing this. Briefly, just want to concur with the vast majority of the testimony, particularly want to highlight the excellent points made by the psychologist. Pardon me for not catching the name, about the discrepancy we often see between developmental age and chronological age. I deal with a lot of pediatric anesthesia, and so on the front line see some of the worst cases of neglect and abuse, and it's horrible stuff. And this legislation in no way makes it okay or gives any hint that we are, as a state, okay with neglecting or abusing our children. I think that in the setting of this last year in particular, we've all seen the deleterious effects of children being sequestered inside, and we're seeing increasingly the actual clinical manifestations of problems from children not being able to go out and play in the park and fall down and scrape their knee and have to deal with it without a parent right there. So more than anything, I think this legislation has done a great job of finding that balance between giving parents the latitude to decide what's best for their children, but also keeping the final say in the hands of the people on the ground, the agencies that are dealing with this, and not being restricted by an age cutoff or some legislated mandate. So I think the message we're sending to our parents, especially to the single parents out there, the lower socioeconomic stratus, the minority parents, is incredibly encouraging, and I think we should all stand with our heads high and proudly support this bill. And perhaps more than anything, it is a legislative unicorn. When you have Assemblywoman Hansen and Senator Harris side by side with the support of Senator Ira Hansen on a bill, it's probably something we all should pay attention to. Thank you very much.
Thank you. They are unicorns. If we can go to, and are there any other callers in support?
There are no more callers in support at this time.
Do we have any callers in opposition to Senate Bill 143?
To testify in opposition to Senate Bill 143, please press *9 now to take your place in the queue. Chair, there are no callers in opposition.
Ms. Bertie, are you in opposition or in neutral? If we can begin a testimony in neutral, and I will begin here in our committee room, please come up to the table and begin when you're ready.
Thank you, Chair Nguyen and members of the committee. This is Kendra Birchie with the Washoe County Public Defender's Office. I believe I've mentioned this committee before, but my office represents not only individuals who are accused of crimes, but we also represent the parents in these 432B cases. I've had the privilege of also being a children's attorney at Washoe Legal Services, as well as I've worked at the University of Nevada, Reno, teaching a course on families and public policies. So I just say that to start with, this is very near and dear to my heart, this issue, and I want to thank Senator Harris and Assemblywoman Hansen for all of their hard work on this bill. It really has been a journey with several different amendments, as you heard even today, with an additional proposed amendment. I want to start with, we absolutely support the intention of this bill. it is greatly needed that we need to clarify our child abuse and neglect statutes, not only in the dependency system, but also in the criminal system. It is very concerning when we're hearing stories about individuals whose children have been removed or a criminal proceeding has been initiated because of things like somebody of a child being outside of the home just unsupervised, where there weren't any other issues. So we greatly appreciate this bill and hope that this will provide some additional clarity to a confusing system that has significant consequences. Just for your information, if someone is convicted of a child abuse or neglect case, it could be a misdemeanor, it could be a gross misdemeanor, or it could be a felony. And the gross misdemeanor or felony are mandatory prison or jail sentences unless there's an evaluation saying that they're not a high risk. So that's just what I'm saying, is that's very significant consequences. All defense attorneys have examples of cases where this bill in particular would have helped to ensure that a child would have remained with the family or that criminal proceedings would not have been initiated. We just hope that when the Division of Child and Family Services creates those regulations, that we are kept in those discussions to ensure that we are doing what we need. And then to Assemblywoman Thomas's point, I would just note in Washoe County and Sparks and Reno, there's different ages for what the requirements are for someone to be at home. And unfortunately, with a lot of the population that I work with, they do move from Reno to Sparks and back depending on what is available for housing. And as we all know, housing is a huge issue right now. And so people may not know that if they cross to the other side of the street, there's a different age limit that they have to be aware of. So we do hope that this provides the much needed clarity. Thank you.
Thank you. Oh, yes. Go ahead, Assemblywoman Benitez Thompson. Ms. Birchie, if you don't mind waiting there.
Thank you so much. And this won't be a surprise. It'll be the same question I've had to the bill sponsor and to Ms. Duffy. Is so the same thing. We're going to prescribe in regs this concept. There's not going to be a chronological age, and so when we talk about sufficient maturity, for the record, how do you see that as being well defined in a regulation?
Kendra Birchie, for the record, with the Washoe County Public Defender's Office, through you, Chair Nguyen, to Assemblywoman Benitez Thompson. I think that's a very important question, and I agree with the statements that have been made on the record. And I would just note that one of the things that I think is extremely important is that it should not be the defense attorney or the parent who has to prove that the child was of sufficient maturity. Just because of the way that our criminal justice system works and the dependency system, the onus should be on the agency to have to provide some of that information. But I do believe that, so that's, I think, something that we need to discuss if we're going to have regulations, and that's why I want the defense bar to be able to participate in that.
Thanks. And I'll just follow up. So I just, having been on I think people are thinking this is a trick question. It's not. Just being on legislative commission, you're going to have members who have to vote yes or no once these regulations are put in front of them, right? And there'll be 3 workshops where they'll be considered. Language will change, but ultimately, I'm just trying to gauge if a regulation comes in front of me and it has a chronological age, does that keep with the intent of the legislation or not? I think I'm hearing no, but I don't think I've also heard anyone definitively say no. And so then I think I've kind of heard definitively say no. So then I'm guessing the regulation's going to use words to describe maturity. So I'm trying to figure out when that regulation, when we're looking at it, did we, what are we looking for the direction for the agency to go when they're writing those regs? So I guess we could put in there clearly the defense attorney for a parent, should have a say or something like that. But I'm not trying to be tricky. I'm literally trying to say maturity. I think I asked about protective capacities, and I kind of heard maybe but I would think for sure protective capacities, and then what does that mean for a child? I would think that because we have some reference to ages in other pieces of the statute or regulation, you might want to put in a floor like under 3, because we know that when child welfare gets the call, that there is a consideration for age, right? That if a child's under 3, those are elevated. So I don't know if there's a consideration for floor, or if the sponsor would be offended if if there was a floor of some kind of age in there. And then you've got a bunch of gray area you're trying to define. And generally, since, 432B is about what you ought not to do, right, then we're defining like almost kind of the inverse in this section, which is what you can do. And so that's harder because it's a different paradigm than the rest of the chapter is written. So it's a sincere question for the record, so we can look back and go, are we close or are we getting it right? Or if I get a set of regulations in front of me and folks come and say, this isn't all what we intended, we would look back to the record to say, well, is that right or wrong, from the hearing? Did they get close?
Chair Nguyen, through you to the Assemblywoman.
Feel free to go directly to the Assemblywoman person.
Thank you. For the record, I can say that we had some discussions, and I don't speak for the sponsors, and I'm sure they'll provide this in their closing remarks, but I would not feel that having a age limit of, for example, 3, of saying that someone at the age 3 should not be allowed to be unsupervised, that would negate the intent of this bill. I think that was some of the discussions that we had about possibly having a floor. The main issue is it's because of every child's different, having that limit of 12 may work for some children, but may not work for others. And so that's why I agree with you that some of the terms that we had used was exactly what you were including in your remarks of what to consider with parental capacity, with the child's capacity, with classes they've had, things like that of that nature, where they know, as we discussed, the numbers to call. They know grandma's down the street and they can go there if they need help, or they are fully capable of calling 911. So those are part of the discussion that we had, and I would not be opposed to if there is included in there a floor that we discussed.
Thank you. And I see also Mr. Armstrong from DCFS that is also on the Zoom. I think he is here also to present testimony in neutral and also can be available to answer those same questions that I believe that will be directed to you by Assemblywoman Benitez Thompson, or if you can answer them as a part of your testimony, that would be great as well.
Thank you. Ross Armstrong, Administrator for the Division of Child and Family Services. We submitted some information to the committee that's in Nellis about child neglect in general. There's a lot, we've heard a lot about the intent of this bill is to really help educate parents, and we wanted to make sure that there was still a lot of good information out there in terms of what child neglect and what child welfare process looks like in the state of Nevada. And you can see that a lot of neglect in many cases ends in physical or sexual injury to a child. And so we want to make sure that in no way are we downplaying the nature of neglect. I also think it's important in our neutral testimony today to note that there's no current prohibition in Nevada law on children engaging safely in independent activities. I think sometimes when we're discussing an issue, it might seem like, oh, we have to make this change because there's currently some obstacle. The way that our child welfare workers in the field assess any situation is there's a call and an allegation, and that child welfare worker goes into the field and assesses the entirety of that situation. There does need to be a determination of whether there's going to be a substantiation to the actual allegation of abuse or neglect. But really, the model of child welfare now, very different than, say, the criminal justice process, where the idea is something has happened, you determine beyond a reasonable doubt did it happen or not, and if so, here's your punishment. The child welfare system is very much focused on getting to a situation that someone has alerted the agency to and working to determine if there are actual ongoing safety threats to that child's safety. So we're not going to open a case just because there might have been a kid walking down the street alone and that one particular instance was unsafe. We're going to really take a holistic approach at the family. And so we provided that data to the committee for your information. To respond to some of the questions from Assemblywoman Benitez Thompson's questions about the regulations, I can't speak for the bill sponsors, but I really appreciated the concept of protective capacity. Generally, when we analyze protective capacity in the child welfare system, we're talking about the parent's ability to protect the child from harm. But taking that framework of maturity is really, in my idea, synonymous with development, the level of development, and then adding that element of the child's protective capacity really makes sense in terms of how to articulate that advice to the 3 different child welfare agencies. I don't imagine that the regulations will have some sort of like age and activity or region matrix, but that rather it's really the regulations will get guidance to social workers in the field when they have an instance where neglect has been called in and it's a child who has been is not under the supervision of anybody, who may be engaging in independent activities, may be neglected, that those regulations really help educate and get the child welfare workers to view those particular situations with certain standards. And so I think, having information about the child's protective capacity in there is key. In all of our cases, again, we take a look at that individual's family situation because no 2 families are the same when making determinations about a substantiation of allegation of abuse or neglect, and also the need for an agency to become involved to step in and try to help and support that family maintain safety, and really trying to get to the point of the Division of Child and Family Services vision of safe, healthy, and thriving kids in every Nevada community. So we are neutral on this. We appreciate the many meetings and the work on trying to make sure that this language is designed to be helpful to parents and not judgmental to kids. There's been a lot of work from a lot of different stakeholders. We certainly appreciate that. I'm, of course, happy to answer any other clarifying questions that I might be able to.
Thank you. And Assemblywoman Benitez Thompson, do you have any follow-up questions?
No, not at all. I think there's enough there to the direction, and obviously Mr. Armstrong will be tasked with writing this, so we'll see it from his department coming forward. And then it sounds like the workshop process will help inform the process as well. It's one of those things, and it's not just this piece. It's any law where you're silent on something and you're going to put a reg in, then you're no longer silent anymore. You're kind of doing a what's in and what's out. And right now, nothing's in, so we're going to clearly define some stuff in by defining stuff out. So it's just one of those things where you want to make sure you've got kind of a bright line of where you're going to walk as things are drafted moving forward.
Perfect. Thank you. At this time, I will go to the line to see if we have any. We have someone also in the building. So please feel free to come up to the desk and begin when you're ready.
Madam Chair, members of the committee, sorry I wasn't fast enough. This is Jeanette Beltz, Jeannette, last name Beltz, Belz, representing the Nevada Children's Advocacy Alliance. First of all, I'd like to extend the regrets of Executive Director Dr. Tiffany Tyler Garner. She was unable to attend the hearing today. CAA is neutral after consultation with many parties, including the child welfare agencies, law enforcement, the bill sponsors, and attending their briefing. CAA appreciates the amendments to improve the bill, including Clark County's amendment, and implore you to continue to ensure protections for children while addressing the over-representation of certain populations and communities in the child welfare system. We would like to extend special thanks to Sarah Adler for her diligence and many, many conversations and texts about this. And CAA definitely looks forward to working with DCFS and other stakeholders in the development of these regulations. Tend to agree with Assemblywoman Benitez Thompson that that's really where the meat is going to be ultimately, and appreciate her questions in that regard. Thank you so much.
Thank you so much. Do we have any other testimony in neutral on this bill? Broadcast Services, if we can next go to the lines to see if there are any callers in neutral.
To testify in neutral to Senate Bill 143, please press *9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. And that I will call our bill sponsor back up to the table for any closing remarks on Senate Bill 143.
Thank you so much, Chair Wynn, for giving us so much time to hear this important bill. I really appreciate it. I think there's been a lot of discussion and a lot of great questions from the committee, and so that's always appreciated as well. I do have a lot of faith in Mr. Armstrong and the administrative procedures, as I am an administrative attorney. And so I believe through the workshops with the participation of the experts, they can definitely nail down these details much better than I could in statute. And Assemblywoman Thompson, to answer your question about a floor of 3 years old, I would be more than happy to have a floor of 3. But I think that's probably as as much as I would be willing to commit when it came to an age limit. And I think that's particularly because we can all agree a 3-year-old does not have that protective capacity as you were describing, even the most mature of 3-year-olds. And so with that, I think we're probably going to have one last amendment to add on some bill sponsors. I know Assemblyman Hafen would like to be added on, which likely means I need to remove myself. I know Assemblywoman Krasner expressed some interest, I believe, on being added on as well. And so I will be working with Assemblywoman Hanson. Assemblywoman Wynn has suggested she'd like to be on, and Assemblywoman Peters. And so, look at that, Assemblywoman Gorlow. I love it. The whole committee. Let's do it, guys. I'll be working with Assemblywoman Hanson to make sure we get you all amended on this side. So thank you all so much for your time. And if you don't mind, Chair, I'd like to let Assemblywoman Hanson make some closing comments if she'd like.
No, that'd be fine. Go ahead, Assemblywoman Hanson.
Yes, please.
Thank you. I know you're ready to move on, and we just want to thank you so much. And just to reiterate that we are not here in any way to discourage concerned citizens from reporting suspicious or concerning behavior that they might see in their neighborhoods involving children. In fact, we would ask them to reach out and contact those parents, maybe person to person. But if that's not possible, of course, to report if you're concerned. And again, this is the spectrum that we're talking about, is to just reaffirm responsible parents that they have the ability to make those kinds of decisions about their children and their reasonable independence. Thank you again for your time. We appreciate the stakeholders involved and for all those, including yourselves, that work hard on behalf of the children of the state of Nevada. Thank you.
Thank you. And with that, I will close the hearing on Senate Bill 143. At this time, I will begin. We have 2 more bills, so we're going to power through all these. And luckily, we have the same presenter for both of them. So if I can welcome Senator Orenshaw to Assembly Health and Human Services. And I will have you begin. Do you have any preference on which one you want to go with first?
Chair, whatever's Chair's pleasure.
Okay. Why don't we start with Senate Bill 146? Senate Bill 146 revises provisions relating to mental health services for children. And please begin when you are ready.
Thank you very much, Chair Wynn and members of the Assembly Committee on Health and Human Services. For the record, James Orenshaw, represents State Senate District 21, parts of Henderson, unincorporated Clark County. Senate Bill 146. It's a short bill, but I think it's a very important bill. And it deals with children being admitted to an inpatient mental health facility, being admitted acute, which is a scary thing if that happens, if it's your child or a child you're representing in court, or even a child that you just happen to hear about what's going on. Oftentimes, the treatment is desperately needed, and that's why the child's being admitted. Senate Bill 146 tries to make sure that if that child who's being admitted acute to an inpatient mental health facility already has a mental health provider, they're already getting treatment, that they're consulted, that provider's consulted, and that if the child is to be admitted, that the strongest attempts at continuity of care do happen. Certainly, I think many of us who practice either in juvenile court, family court, have seen cases where a child's admitted and maybe there is a disconnect between the mental health provider who treated them before, and the information that provider has is not always available. So with that being said, Chair, I wonder if I could, with your permission, turn it over to Jillian Block of the Legal Aid Center of Southern Nevada and Amy Honadell. Amy's on Zoom, and Jillian, I believe, is here in Carson City. And then I'm happy to answer any questions.
Perfect. Who would you like to start with first, Ms. Honadell or Ms. Block?
Chair's indulgence, not court's indulgence. What's your preference?
It's a habit. I do it.
I'm just here to answer any questions so we'll let
I'll go to Ms. Honadell first. Thank you, Chair.
Welcome to Assembly Health and Human Services. It's always nice to see you, Ms. Honadell. Go ahead and begin when you're ready.
Thank you, Madam Chair, and thank you, members of the committee. My name is Amy Honadell, that's spelled Amyhonodel. And as Senator Orenshaw mentioned, I am a staff attorney with Legal Aid Center of Southern Nevada in the Children's Attorneys Project, where I also serve as their strategic initiatives manager. And like he said, this bill is short, but it is critical for our youth in foster care in that it opens and solidifies a conduit of communication between mental health providers, those who see a foster youth regularly, and those who are seeing the child in crisis as they're being admitted or considered for admission into a mental health facility. And the bill is short, including the amendments that have been worked on by the various stakeholders. And I'll just walk the committee through it really quick. Just part one requires the admitting facility to find out from the legal custodian if there is a main provider or treating provider of mental health services for that child, and to make a reasonable effort to contact that child. The second part of section 1 requires, that was the second part. When they talk, the provider who usually sees the child in the admitted facility to talk about the child's condition, including whether or not to admit that child. Part 3 then requires the admitting facility to try and get consent from the legal custodian, as well as consent from the child to have this ongoing dialogue with the main treating provider, including coordinating discharge planning. And then subpart 4 of section 1 just says that if an admitting facility cannot get consent from either the legal custodian or the child, that they can still take the necessary actions, including communicating with that main treating provider if it's in the child's health and welfare to either maintain it or improve it. And so this bill is really brought out of our real world experiences down here representing children in Clark County in foster care. And that is, in some cases, we see where this communication would have either prevented an admission. I have a client, actually a former client, who was facing going with her biological father and made some comments that were considered to be enough to admit her to a facility. But when her primary treating therapist got involved, it turns out the comments were really not about a crisis, but her, repeating something she had heard someone else say to avoid being moved. And we were able to address her concerns without her being admitted to this facility. Another client of mine who, he's still my client, he was admitted to a facility and was given a new medication, which really helped his behaviors, some of the concerns. He was able to address some of his impulsivity and his anger. But for whatever reason, as he was discharged, the fact that he had a new medication did not get relayed to his ongoing providers, his therapists or his doctors. So he had an outburst which caused him to disrupt. He was with an uncle at the time who was new to raising children. He had no children of his own and new to my client's diagnoses. And because of the intensity of the outburst and just an inability to contain it, he was afraid to take this client of mine back into his home. So if we had had more of a coordination of discharge planning, we might have been able to avert this crisis. Now, this is in no way to undermine the care that these hospitals provide. We just want to get everybody communicating and on the same page. With children who aren't in the system, this is something a parent would do, but a lot of my clients don't have healthy parents right now to do this. So this will just solidify that communication for that. And with that, I appreciate the committee's time and thank you for your attention.
Thank you. Senator Orenshaw, do you have any other people presenting this bill?
Chair, I think Ms. Honadell and Ms. Block and I are ready for questions.
Okay, I didn't see any come across my Skype chat, but luckily we're all here, so I can look around. I see Assemblywoman Titus. Go ahead.
Thank you, Madam Chair, and good to see you, Senator. Thank you for bringing this bill forward. I have a question specifically on Section 1, Number 4. Under failure of a person or entity having legal custody of a child or a child to provide consent, then this gives directives to go ahead and proceed anyway based on if it was necessary to protect or improve the health or welfare of the child. My question is, if the person or entity having legal custody said, no, we don't want you to do that, so this will supersede, if they say, no, you can't do that, you're going to go ahead and do it anyway? Is that what I'm reading here?
James Orenshaw, Senate District 21, to you and through you, Chair, to Assemblywoman Titus.
Senator Orenshaw, please feel free to go directly to the member.
Okay, thank you. Assemblywoman Titus, the way I read it, and please correct me, Ms. Honadell or legal if I'm misinterpreting it, but the way I read it, the objection of the guardian to the contact between the treating mental health provider prior to admission to the facility, that conversation could still happen even if there's an objection, and that's to try to make sure there's continuity of care. So I think that's how I read it, and if I'm misinterpreting it, Ms. Honadell, please feel free to jump in and correct me.
This is Amy Honadell for the record. And just to agree with what Senator Orenshaw stated, it's just limited to that particular part of the consent. It would still allow for continuity of care in this case.
And thank you for that. I just needed, I'm sorry. I just needed some clarity.
I was going to say, and there's language in there limiting that, so it's only when necessary to protect or improve the health or the welfare of the child, so it doesn't allow the provider to go beyond that.
Okay, thank you for that clarity, because there could be an instance in my mind where maybe the parent didn't like the initial provider, and they wouldn't want that provider communicating with another provider. So I just wanted to make sure that there was some level of parental control still involved, or whoever had legal custody. But I do understand the concept of a safe handoff. I do understand being able to communicate with fellow providers, but just had a little concern over that particular issue.
Thank you. And James Orenshaw, Senate District 21, again, Assemblywoman Titus, the way I read this would be more of the cases where that parent or guardian might not be quickly available and versus trying to go against their wishes. But that's how I interpret where this would be mostly used.
Thank you. And thank you, Madam Chair, for the question.
No problem. Do we have any other questions from Assemblywoman Benitez Thompson? I'll go to you, and then Assemblywoman Thomas next.
Thank you so much. And thank you so much, Mr. Orange. Also, I think I wanted to just get on the record how you see this being enacted. So Section 1 on the shall about asking, I imagine that would just be a question, one of the questions on a questionnaire when you're kind of starting that admission process for someone where you're collecting like demographic information. That would be fine to be a piece of information that's being requested kind of on those admission forms. Would that be acceptable, or do you want like a verbal request?
Assemblywoman Benitez Thompson, James Orenshaw, Senate District 21. Certainly I would want as much effort as possible from the inpatient treatment facility to try to reach the current provider, because I know that I've had cases where I've represented children who maybe are not under 432B, but in the delinquency system, and I've had parents who, feel that they were doing very well with their outpatient mental health provider prior to being in an inpatient facility and weren't doing so well. So I would want, as much effort as possible from the inpatient hospital to try to reach the mental health provider.
Okay, perfect. And then on the second, Section 1, Sub 2, so after they've kind of asked for the information and then they have it, it says the reasonable efforts to consult. So I guess that would, typically when we think of reasonable or kind of due diligence, we tend to think of usually like a number set like 3, like make 3 phone calls or make 2 phone calls, so I guess would you say that you're looking for them to make 1 or 2 calls, and if at that point they haven't heard back, they can abandon the effort, or what would you say is reasonable?
James Orenshall, Senate District 21. I know that, I think the chair will understand this, that in law school they teach us about the reasonable person standard, and I certainly would want as much effort as possible made to contact that prior mental health provider. However, there will be a point where the physician or the treating healthcare provider at that inpatient hospital will have to make some decisions to try to stabilize the child. So here I think that I know we have a letter from the Nevada Psychological Association, but I'm not sure if we're going to have any testimony from them, because I think that someone with that expertise might be better suited to answer that question. And I don't know, Ms. Honadell, if you care to jump in, but certainly I think that there would be a point at which the treating provider at the inpatient hospital would have to take over if they can't get a hold of the prior mental health provider.
It looks like Ms. Honadell has unmuted. Go ahead. Make sure you state your name for the record before you speak.
Yes, Madam Chair, this is Amy Honadell from Legal Aid Center again. And I don't think we can quantify with a number, but what typically happens is these children actually go to our emergency rooms down here while we're waiting, or while the staff at the emergency room or the legal custodian is trying to find a bed for them at a facility that will take a youth. And during that time, that is the time when we would be looking for, once a facility has been identified that has a bed, that they would be making those efforts to find or talk to or communicate with the main treating provider. I don't think it's a good idea to put a number necessarily, but it obviously will depend on the time. If we're talking about after hours or a weekend, then maybe making an effort the next day during business hours, or reaching out to that physician's call service. But the idea would be to make those efforts, but also start bringing the child into care. And I think any concerns are then addressed with the next part when we talk about coordinating care and then discharge planning, so that even if an admitting facility is not able to connect with the main provider, that later on they are connecting with that provider, so that when the child is able to leave, and there's continuity of care on that end.
Thank you. Does that answer your question? And I believe Assemblywoman Thomas, did you have a question as well?
Thank you, Chair, and thank you, Senator, for bringing this Senate bill to us. I think that foster care youth that are in crisis is a very important service that our community can bring forth. But my question is, I believe I heard Clark County. So is this just regulated to Clark County, or is it for the state?
Assemblywoman Thomas, James Orenshall, Senate District 21. This would apply to all the counties. I think it would be helpful, regardless of whether you're in one of the less populous counties, or Clark or Washoe or Carson City, Douglas, just trying to make sure that if a child is admitted acute, that there is that conversation with the prior providers. I think it would be helpful across the state.
I appreciate that. When I heard Clark County, I wasn't sure. I was like, why is it just regulated to Clark County when I'm sure throughout the state foster care, youth are in crisis. So I appreciate that clarification. Thank you.
And if I could jump in, James Orenshall, Senate District 21, sometimes there are children in the foster care system who also end up in the delinquency system, who get arrested. And sometimes the juvenile judge in Clark County may commit a child to youth correctional facilities, such as the Caliente Youth Center in Caliente, Nevada, Nevada Youth Training Center in Elko, or there are some other facilities around the state that are privately run. And if a child who we call dual ward child, who's also in the foster care system, might have a mental health crisis and need to be admitted acute, their prior treating physician might be in Clark County, or might be in Washoe County, or Carson City, Douglas. So I think this bill will be even more important, because you could have a child at one of those facilities, or at there are some private facilities around the state, in some rural parts of the state, that is admitted acute. And here at least we'd be requiring them to try to reach out to that doctor, even if they're down in Las Vegas or Henderson or up in Reno. And in the past, I'm not sure that effort was always made.
Thank you. Do we have any other questions from committee members at this time? Okay, do we have anyone in the room to testify in support of Senate Bill 146? A mad rush to the table.
Good afternoon, Chair Nguyen and members of the committee. Kendra Birchie again with the Washoe County Public Defender's Office. We just wanted to put our support for this bill on the record. We have seen instances where children have been harmed because they were admitted into hospitals for these emergency placements when their treating physicians were adamantly opposed to it afterwards. I can speak from personal experience with my clients that this has been an issue in Washoe County. And so I'd assume it's occurring across the state from what we've heard. And so we really appreciate Senator Orenshaw for bringing this bill and championing, and improving the lives of our children. So we thank you. We urge your support.
Thank you. Do we have any other testimony and support here in the room? Going once, going twice. Okay. Broadcast services, if we could go to the phone lines to take testimony in support of Senate Bill 146. I also see quite a few people registered to testify on this bill. Again, please state your name and clearly state it for the record and limit your testimony to 2 minutes. And let's begin.
To testify in support of Senate Bill 146, please press *9 now to take your place in the queue. Chair, there are no callers in support at this time.
Okay. Well, if we have any callers in opposition, please test. Oh, wait, I see Miss Duffy actually on the Zoom. I forgot to go there. If we have any other people on the Zoom that want to testify in support of Senate Bill 146, I will start taking you, but I will start with Miss Duffy. Go ahead. Again, please state your name for the record and please limit your testimony to 2 minutes.
It'll be faster than that. Good afternoon, Chair Nguyen and members. This is Bridget Duffy, B-R-I-G-I-D, the Director of the Juvenile Division for the Clark County DA's Office, appearing on behalf of the Department of Family Services in Clark County. SB 146 is solid policy in the best interest of children in foster care. It supports better coordination of care between admitting acute psychiatric treatment facilities and our current treatment providers. We thank Senator Orenshaw for bringing forth this piece of legislation and our community partners at Legal Aid Services for their work on behalf of our children in foster care.
Thank you, Ms. Duffy. Do we have any other people on Zoom to testify in support? Seeing none. Broadcast services, if we can go now to the lines to see if we have any testimony in opposition, or do we have anyone in the room to testify in opposition? Seeing none. Do we have anyone on the Zoom to testify in opposition? Seeing none. If we have anyone on the line.
To testify in opposition to Senate Bill 146, please press *9 now to take your place in the queue. Caller with the last 3 digits, 214. Please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 214. Please press *6 to unmute. Chair, we seem to be having a technical issue. The caller is unable to unmute. Oh, never mind. Here they are. Caller, you're unmuted.
Hi. Okay. This is Dr. Lori Drucker with the Nevada Psychological Association. I'm sorry I was having problems with the technology. I am here to testify in support of this legislation. And is this the right time for me to be speaking?
You know what? It's okay. I know there were some technical difficulties.
Hello?
Well, yes. Can you hear me?
Yes, I can.
Go ahead and testify. We'll make sure that your testimony is reclassified in support. Go ahead.
Okay. I want to thank Senator Orenshaw and the committee for your work on this legislation to improve the coordination of care for foster kids. in Nevada. We appreciate that the language was expanded to include notification of a wider range of providers of mental and behavioral health care for these children. We believe that the efforts to notify the primary treating providers of kids when there is a crisis and they may need an acute stay will be beneficial for the children primarily, and also for the coordination of care across the systems of inpatient and outpatient treatment. So thank you very much for taking my testimony, and I apologize for the technical problems.
That's okay. We're being flexible here. We all are. I think we all have these issues going forward. Broadcast services, do we have anyone else in opposition? Or do we have anyone in opposition, I should say?
There is nobody on the line in opposition at this time.
Wonderful. And then do we have anyone that's testifying in neutral on Senate Bill 146 that's in the room here today? Seeing none, I see someone has unmuted, and I wish I could see that name on there. Tusi, I think. Is that correct? Okay. Man, I might need glasses, you guys. If we can go ahead and please unmute yourself and state your name for the record and begin your testimony in neutral.
Thank you, Chair Wynn. For the record, my name is Alexis Tusi, Alexis-Tucey. I'm a Deputy Administrator at the Division of Child and Family Services, testifying in neutral today. I would also like to say that it has been a great pleasure working with the bill sponsor as well as the stakeholders with this particular bill, working through amendments and really looking to improve our continuum of care and process with this population through the important services that they need. So again, just testifying in neutral, and if there are any questions or comments, I will be able to assist with any of those, but thank you.
Thank you. Do we have any questions here? I'm seeing none. Broadcast services, do we have anyone on the line in neutral?
To testify in neutral for Senate Bill 146, please press *9 now to take your place in the queue. Chair, there are no callers on the line to testify in neutral at this time.
Wonderful. So I will ask Senator Orenshaw to come up and see if he has any closing remarks on Senate Bill 146.
Chair Wynn, members of the committee, James Orenshaw, Senate District 21. Thank you for hearing Senate Bill 146. As I said, it's always scary when a child has to be admitted acute to an inpatient treatment facility. Sometimes there's a lot of great treatment that a child can receive there, and it is the best option for that child. I think that this legislation, if it passes, will try to help improve outcomes for those children who do have to be admitted or perhaps don't have to be. But I think if that communication can happen, if they have an ongoing treatment provider, there'll be better outcomes whether they're admitted or not. Definitely want to thank Bailey Bortolan and Amy Honadell and Jillian Block of Legal Aid Center, and Bridget Duffy of the Clark County DAs, Dr. Tusi, and many other stakeholders who worked on this legislation. We did amend it over in the Senate, trying to, get it right, and I appreciate your committee's consideration. Thank you.
Thank you. And with that, I will close the hearing on Senate Bill 146 and open the bill hearing on Senate Bill 376. This revises provisions relating to child welfare. And again, welcome back again. Senator Orenshaw, please begin when you're ready.
Thank you, Chair Wynn, members of the committee. I'm still James Orenshaw. I represent State Senate District 21, parts of Henderson, unincorporated Clark County. During the interim, I had the distinct honor of chairing the interim committee on child welfare and juvenile justice. And we had some challenges. We were able to have 6 meetings. We had 2 in-person meetings before the pandemic hit over at the Grant Sawyer building with a teleconference up here to Carson City. Then the pandemic hit, and we really weren't sure how we'd finish all our work because we had a lot of work that we had to do from the prior session from bills that came through. And with great help of our staff, Mr. Guinan, Patrick Guinan, Julianne King, Eileen O'Grady, Carleo Krent, all the broadcasting and IT people here at LCB, we were able to continue, have our meetings, and come up with 10 bills, recommendations for letters on different issues, and really accomplished a lot of good work. Most of our recommendations were bipartisan, and most, I believe, were unanimous. So we were able to come to consensus on a lot of the work of the Interim Committee on Child Welfare and Juvenile Justice. Vice Chair was Assemblywoman Danielle Monroe Moreno, who was prior chair of that committee and ably guided policy through that committee. One of our recommendations is Senate Bill 376. And Senate Bill 376 is an effort to try to protect children in terms of the child welfare system, and trying to make sure that someone who works for either Child Protective Services, or sometimes called Department of Family Services, will have the information they need in terms of making the best decision for the protection of that child. And with me, Chair, with your indulgence, I'd like to turn it over to Tim Birch and Joanna Jacob from Clark County, who are on Zoom. And then, if it's okay with you, Chair, I'd be happy to answer any questions after they go through the bill.
No, that's fine. Go ahead and proceed when you're ready.
Good afternoon, Chair Nguyen and members of the committee. It's a privilege to be back here in front of the committee. I am just here today to share the PowerPoint. I'll be assisting Mr. Birch, who will be delivering a bulk of the presentation. We have a very short presentation. It's just a lot of information that we have put into a PowerPoint to kind of give you the overview of the bill, and then we can stand for questions. So if you'll just stand by, I'll share my screen, and then Mr. Birch can navigate us through. Okay.
All right. Good afternoon. Thank you, Madam Chair, for this opportunity. Tim Birch, Timburch. I am the Human Services Administrator for Clark County. Thank you for the indulgence of this committee while we walk through this short deck. This change is a technical change, so we thought it helpful to show you within context where that fits. One of the primary goals of child welfare is the safety, permanency, and well-being of our children. One of the principal tools that we have to achieve that goal are investigations into reports of abuse and neglect. Each investigation that's conducted should end in a disposition of that investigation, so we know the outcome. The dispositions of substantiations help us frame the intervention with the family. What protective capacity is the parent lacking in this situation? How can we help surround that family with the proper resources to potentially address that gap? It helps inform future investigations as well, in case we have repeat situations where a child comes into our attention, to examine past patterns. Again, always looking to examine the protective capacities of a parent. And then lastly, when we do find that there's a substantiation, a positive finding of abuse or neglect, that maltreatment that happened in that household, we report that to the central registry. The central registry is important in that that's where employers go to look to screen individuals who will be employed to work with children in the future. It is also where we pull a lot of our reporting data to help justify our funding and other types of things. I would call out that there were amendments to the initial bill presented in the Senate that with the defense attorneys that clearly articulates that we're only, as we have always, only reporting substantiations into that central registry. Next slide. So what happens, there's been a lot of conversation already and today about what happens when someone calls into the child welfare system. We receive a report from someone who suspects child abuse or neglect is happening. We screen those decisions in using a rubric to examine the law and to see if anything that's being told to us rises to meet the standard of abuse or neglect according to NRS 432B. In situations where that does appear to be the case, we assign that out for investigation to a CPS worker, and then we also assign a priority to whether that person needs to respond immediately within the next 3 hours or within 1 business day to get out and investigate that allegation. Next slide. Just to give you a quick frame, we received this last year over 25,000 calls into our hotline reporting abuse or neglect. Less than half of those, about 11,600, actually wound up being assigned for investigations, about 40% actually. Next slide. So once an investigation is assigned, we do go through a process, and some of that's been, again, discussed already here today. We look to see if that family has central registry history, if that person is in our case management system, if we have prior interactions, are there past history or patterns. We do this initial assessment. We then go out and interview the alleged victim, the alleged perpetrator, collateral sources, teachers, responsible adults in the home, and the like. We move then into doing a full safety assessment. We have 45 days in order to fully assess the well-being of that child, to move to a place of giving a disposition. Right now, when we enter a disposition to the case, we have two choices in the state of Nevada. Next slide. And those are substantiated or unsubstantiated. So substantiated is that there was reasonable cause to believe that abuse or neglect occurred in this situation, and the person that has been alleged to be the perpetrator was responsible for said abuse or neglect. Or unsubstantiated just really means that there was insufficient evidence. We could not establish that threshold, and we have to choose one or the two of those dispositions. Next slide. You'll see that a vast majority of cases go unsubstantiated for a myriad of reasons. We are very thorough. It is our goal to always keep children safely in the home with the parent, if possible, and wrap that child with resources. So this last year, we had 2,400 substantiated investigations. Again, and this is Clark County specific data. Next slide. These next two slides are just to show you in context how other states deal with this issue. Right now, currently, again, we have the two disposition types. Texas has 5. New Hampshire has about 7. Next slide. Missouri, obviously about a dozen there. California has 3. And what we've done is look more toward the Texas model. So next slide. So what we're bringing before you really is the ability to amend 432B 300 in Section 6 to allow us to add the two following types: unable to locate or contact, and administrative closure. And then likewise change the standard of proof from reasonable cause to preponderance of evidence. And that really just aligns with current state policy and current practice. So we're looking at trying to align everything. So as stated before, families know exactly what to expect from the system, and then we're right out front with that. Next slide. So unable to locate or contact, you're all well familiar with how transient some of our population can be. It is not uncommon for us to get a report of suspected child abuse or neglect at a particular weekly motel or an apartment, and even within the hour that we respond to that call, that family is unable to be located and no longer in that facility. Currently, we have right now no choice but to label that unsubstantiated because that's the only disposition type that would lend itself for the insufficient evidence at that time. The unable to locate or contact now, if supported, would allow us to label it in that way so that we know it hadn't really thoroughly been investigated, so that other jurisdictions, even within Nevada, would see that there's an allegation of child abuse or neglect that wasn't sufficiently investigated, and they can pick that up as a part of any potential future interaction with that family. Next slide. And administrative closure really is just purely, it's out of, we don't have the authority to investigate that. It is out of jurisdiction. We currently, again, substantiate those. Currently, this would allow us to put an actual administrative closure on a case that came to us for, let's say, Nye County or another jurisdiction, and be able to hand that then properly over to that appropriate jurisdiction to investigate while wrapping up that case in the case management system so that we know that it was properly adjudicated. Next slide. Again, as I stated before for members of the committee, this is a very technical change, but we feel it's one that will help us more clearly articulate the status, the disposition of investigations so that we can better provide for the safety, well-being, and permanency of the children that we were charged with providing protection to. And with that, I will make myself available for any questions.
Thank you, Mr. Birch. Do we have, and Ms. Jacobs, do we have any other presenters? I don't believe so.
Chair, no. Happy to answer any questions.
Okay, I'm looking around. See if we have any questions on this. I'm looking. Oh, I have Assemblywoman Benitez Thompson, and then I'll go next to Assemblywoman Thomas.
Thank you so much, and I appreciate this, and this makes a lot of sense to have something more than just substantiate or unsubstantiate and give more of a better type of description to what's happening when you can't move forward with something. So like let's take for the example that unable to determine. So let's say that you've got a call in regarding sexual abuse of a child, and let's say that child is 6, right? They're of an age where they might not accurately be a self-reporter. So if you ask them yes or no, if they indeed have been harmed by a family member, you're not sure that they're going to tell you yes or no, right? So that kind of age type of a development of a child. And so, like for an undetermined, if you see some evidence, but you're not, after you've done investigations and you kind of get to the end of the process and you're not able to have enough sufficient evidence, would this be a case where you would say, well, unable to determine, and then there would be that history of the investigation there, and then 6 months later, if another call comes in and same kind of a thing, where you would be able to look back and kind of see a trend of these kinds of calls and the work that the agency has done? Would that be the right way for us to think about how something like that would be used?
Chair, James Orchall, Senate District 21. With your permission, I'd like to defer to Mr. Birch, and then I'm trying to clean up if I can.
Go ahead, Mr. Birch.
Thank you, Madam Chair. If I may directly to Assemblywoman Benitez Thompson. The changes we're requesting currently, that situation that you described would be unsubstantiated. We, in the case of a young child who there's an allegation of sexual abuse, we would take them to our Children's Advocacy Center, where we're co-located with forensic interviewers, and they would go through a very in-depth, rigorous process geared specifically toward the psychology of a child and how you conduct that interview in a very safe way for them. While meanwhile, of course, law enforcement and other professionals would be interviewing the alleged perpetrator. If there was insufficient evidence there, that would still be an unsubstantiated because we did conduct an investigation. Really, this unable to locate or contact or administrative closure would not apply in that specific situation because we did, in fact, contact that family. That case, in its very specific reference, would most likely wind up in that substantiated or unsubstantiated category because of the investigation being conducted.
Assemblywoman, go ahead. Senator
James Orchall, Senate 21. And I think that this will give the agency, more tools, but I think it'll also protect families and parents, basically that only a substantiation would go to that central registry. That was an amendment proposed by the Washoe County Public Defender's Office over on the Senate side. And Ms. Birchie was here, but, she's still here. And we accepted that amendment to try to make sure that only a substantiation would go into that central registry, and that nothing short of that would. And I think she might speak to that later.
We can go to Assemblywoman Thomas next.
Thank you, Chair, and thank you, Senator Orchall, for bringing this Senate bill to us. I feel very fortunate today to be among these committee members to hear such bills. I am really a child advocate myself. But my quick clarification question goes to, I believe Mr. Birch had indicated there is 45 days to assess the child. I'm assuming that's the child's environment. And I just want to know if that was, in fact, the child's environment and or the 45 days, is that consecutive days? Thank you.
Yes, Madam Chair, through you, to Assemblyman Thompson. The assessment is done of the child's functioning, the family functioning, parent protective capacity, the environment, anything that plays into the allegation. If it was an environmental neglect allegation, then we certainly environment would play a heavy role in that, although we assess the environment for every investigation. And that is 45 consecutive days for us to be able to wrap up those safety assessments so that we can keep in line with the practice model and, of course, giving parents their rights and day in court in a timely fashion as well.
Thank you. I appreciate that. Thank you, Chair.
Thank you. I have a question too. I know prior to this bill, and if this bill was as it stands right now, we only have those 2 dispositions. Does that kind of make us an outlier, like nationally? Like, do other states have multiple dispositions like this bill proposes?
James Orenshall, Senate 21. Thank you for the question, Chair. My recollection of the presentation during the interim committee was that many states have, more than just the substantiated, unsubstantiated in terms of possible outcomes, but as to how many have just what we have, that I don't have that answer, but I can try to get that for you and find that out.
Thank you. That would be great. Do we have any other questions from committee members here? Seeing none, I will go first to the room. Is there anyone here to testify in support of Senate Bill 376? Seeing none, I will see if there's anyone further on the Zoom to testify in support of Senate Bill 376. And I see Ms. Birchie kind of moving towards the table. Were you here to testify in support? Oh. She is. Go ahead and begin when you're ready.
Thank you, Chair Nguyen. Kendra Birchie with the Washoe County Public Defender's Office for the record. I just want to thank Senator Orenshall as well as the other stakeholders for allowing me to participate in the discussion to ensure that we are protecting the rights of the parents as well. There were some concerns that we initially had that we were able to resolve with the amendments to make sure that if one of the new dispositions was determined, that information was not provided to the central registry. And then that information, if there's anything that exists in the central registry for an unsubstantiated claim, that's not provided to employers. That's our biggest concern with this bill, that the additional information would be provided, and which has significant consequences on parents. I can say I have a parent that I'm still working with trying to figure out employment and housing because of the substantiated disposition that was released. So we appreciate this bill. Thank you.
Thank you. And Broadcast Services, at this time, if we can go to the call line and take testimony in support of Senate Bill 376. Again, I'd remind callers to clearly state and spell your name and limit your testimony to 2 minutes.
Chair, the public line is open and working, but we have no callers to testify in support at this time.
And next I will begin opposition testimony of Senate Bill 376. Do we have anyone in the room? I don't see anyone in the room. I don't see anyone popping up on Zoom. Broadcast Services, is there anyone on the line in opposition?
Chair, the public line is still open and working, but we have no callers in opposition at this time.
Finally, I will go to neutral testimony on Senate Bill 376. I see Ms. Tusi on there, unmuting herself. It doesn't appear there's anyone in the room, so if we can go to the Zoom. So begin when you're ready.
Thank you, Chair Ryan. For the record, my name is Alexis Tusi. Alexistucey, testifying in neutral today for SB 376. Again, we appreciate working collaboratively with the sponsors as well as the stakeholders involved in this bill and moving forward towards, again, looking at safe, healthy, and thriving youth in every Nevada home. So again, we appreciate the collaboration with this and appreciate everyone, again, looking at this population, looking at their best well-being. Thank you.
Wonderful. And do we have anyone on the line in neutral broadcast services?
Chair, the public line is still open and working, but we have no callers in neutral at this time.
Wonderful. If I can bring back our sponsor for any closing remarks you might have.
Thank you very much, Chair Wynn. During the interim committee, there was no opposition, no concerns to this bill, and we heard the concerns of the Washoe County Public Defender's Office here during the session. They have a family defense unit that represents parents in these actions, and I do appreciate Clark County and Tim Birch, Bridget Duffy from the Clark County DA's office working with the Washoe Public Defenders and their family defense unit, trying to strike a balance here. I think this bill does give the DFS workers some extra tools so that they have a little more knowledge to know if something necessarily wasn't unsubstantiated, but just the family wasn't able to be located or there wasn't jurisdiction to open up a case there, but also to protect parents where there is no substantiation. And I think that it makes that clear in the law, which is an improvement. I definitely want to thank Administrator Armstrong, who worked tirelessly during the interim on that committee, Bailey Bortolin of Legal Aid, ACLU, Holly Wellborn. I think we came up with some good legislation. I hope your committee will consider moving forward with Senate Bill 376. Thank you.
Thank you, Senator Orenshaw. And at this time, I will close the hearing on Senate Bill 376. And for our final item on the agenda, it is public comment. I don't know if there's anyone in the room that would like to testify in public comment. If you would like to do so, this would be the time to come up to the table. Kind of walking? Nope, walking out. Broadcast services, if we can go to the line for public comment. I think I know the answer to this, but just to make sure, do we have any callers on the line for public comment?
Chair, once again, the public line is open and working, but we have no callers for public comment at this time.
Wonderful. So at this time, I will close public comment. This will conclude our meeting for today. I want to remind members, we will not be having HHS on Friday, but do plan on having a very busy week next week on Monday, Wednesday, and Friday as we start processing a lot of these bills. And I appreciate your patience today and attention to all the bills that we heard. And at this time, the meeting is adjourned.